Good morning to the future doctors of India. Me, Shriya Sharande, welcomes you to Shri Chhatrapati Academy Pune Study Ayush Forum by the students for the students. Right? Now let us start our today's session. First of all, welcome to you to the field of treatment. Right? Today's agenda: human physiology from modern perspective. Human physiology or Kriya Sharir is today's our subject, right? Now when we start something, we have to take an inspiration, right? So today I have brought some inspirational clip or inspirational thought before you. That thought is: education is the weapon through which you can change the whole world. The thought given by one of the best personality, Sir Nelson Mandela, right? Now today's our topic is, as you can all see on the board, that is arterial pulse. Usually when we go to the clinic or to the doctor touches our wrist and feels something. What is that? Is he mad? No, he is checking your arterial pulse. तो डॉक्टर तुमची arterial pulse तपासत आहे, right? Now what is arterial pulse? Arterial pulse is defined as the pressure change transmitted in a form of waves through arterial wall and blood column from heart to periphery. See the definition carefully. It is a pressure change in a form of waves which is transported from heart through blood vessels towards the periphery, right? When the heart contracts, the blood is ejected into the aorta with a great force, right? When there is a systolic movement of the heart, volume decreases, so pressure increases, right? It causes the distension of the blood vessel. What is meant by distension? Anybody? So distension means it is an elastic property, the property to stretch. Distensibility, we say, of the blood vessel and rise in the pressure. A pressure wave is produced on an elastic wall of the aorta. This travels rapidly from the heart and can be felt after a brief interval, very short interval at any superficial below the skin. We have seen that in our anatomy lecture, which is introduction to anatomy, some basics, that is superficial, below, just below the skin, right? Just below the skin. Any superficial peripheral artery, like radial artery. Radius is a bone, lateral bone of the forearm. On its superficial part there is one artery. It is very easily, means pulse rate is very easily checked near the wrist at that radial artery, right? Superficial radial artery. Next part. Now transmission of pulse. How the pulse is transmitted from the heart towards the periphery. When the pulse is generated at the heart, it is called a central arterial pulse. And when it travels through all the blood vessels and reach towards the periphery, it is called as peripheral arterial pulse. Formation and transmission of pulse wave depends upon the elasticity of vessels, right? Now, elasticity of vessels. Some vessels become rigid at the edge. The next point we will see that. So we will see the next one, right? Formation and transmission of pulse wave depend upon the elasticity. How much that blood vessel is stretchable. At that point, its formation and transmission is dependent. It is dependent on that elastic property of the blood vessel. Thus, when the walls of the arteries are more distensible, the pressure rises less. Now, let us assume a balloon. In that balloon is stretchable, as we all know. When we blow air on it, or when we pour water for Holi and all, we pour water and it gets stretched, and so much pressure is created, but that pressure is little bit. But when you fill the water in this bottle, it has some capacity. After that capacity, it cannot means it cannot take the water, or it may burst, right, when we put an extra pressure. In the same way, when the walls of the arteries are more distensible, more elastic, the pressure rise is less, and so the transmission of pulse is also very less. But when the arterial walls loses its elastic property and becomes rigid, that rigid arteries are seen mostly in the old people, right? Old people means we can say to now seeing today's generation, after 30s or 40s also we can see rigid arteries in the people. Okay. Now, when the arterial loses elastic property and becomes rigid, as in old age, the pressure rises more and the transmission of pulse is also very more. It doesn't mean that pulse rate is more. It is mean that transmission, that is flow of the pulse is more. Means it travels smooth. It does not travel smoothly. Okay, here it can travel smoothly because it is elastic. It can create pressure waves, and that elastic property can also take that pressure waves. But when the elastic property is not anymore, there is some problem in the old age because that arteries have become rigid, right? Now this point is very important from perspective of MCQ. Pulse is not transmitted to capillaries because capillaries are devoid of elastic tissues, right? We know that capillary, right? Then the capillary, arteries and veins, right? Blood or any material flows from arteries to the capillary and from capillary towards the veins. Am I right? So, when the pulse is not transmitted through capillaries. Why it is not transmitted to capillaries? Because capillaries do not have elastic tissues, right? Now, next point is velocity of transmission of that particular pulse. Average velocity at which the pulse wave is transmitted varies between 7 and 9 meter per seconds. Now it is the average value 7 to 9 meter per second, right? Pulse travels faster than the blood. Max blood flow in larger arteries is 50 centimeter per second. It is centimeter, right? Means 0.5 meter per second. So when we compare velocity of blood and velocity of pulse is always greater. Now delay in the transmission. What do you understand by delay? Delay means late, right? Late in transmission, late in traveling. At the arteries, pulse is felt after a short interval from beginning of ventricular systole. When ventricles contract, after that there is some short interval, and then the pulse is felt, right? The delay is directly proportional to the distance from heart, right? Now, the time for which to reach means the time taken to reach from Mumbai to Pune will be different as that of reaching from Delhi to Pune. Mumbai to Pune will be less time, and from Delhi to Pune it is a more time as compared to this Mumbai to Pune time, right? So carotid artery is situated here we can feel it. So carotid artery and heart, the distance is as compared to radial artery is less, right? Radial artery is here, length is more, so the delay is more. So we can directly say that delay is directly proportional to distance from heart to that specific artery, right? Now, devices used for recording arterial pulse. There are three main devices. First one is manometer, second one is Didgeon's sphygmograph, and third one is electronic pulse transducer. So manometer has some cannula, it is fixed here, and with the help of this the your pulse is checked. This is also sphygmograph. Here the pulse is checked and it is recorded on this paper, and this transducer, this works on the principle of light reflection, right? And means there is some light is passed from that waves, and that waves obstruct the light, returning light, when the light is reflected, and that is noted on some paper. And this is a modern technique, very modern technique used. And what is meant by transducers? The transducers are the devices which change any energical form into the pressure, is called as transducer. It is a technical definition of a transducer. Right, now this is a very important point from perspective of our exam, and for becoming a good physician we should also know this point. Now, interpretation of arterial pulse tracing. Pulse recorded in arterial, radial artery or femoral artery is a typical peripheral pulse. Now radial artery or peripheral artery means peripheral artery of femur. Femur also has femoral artery, and that artery are the types of peripheral artery. So it has three main parts, which is anacrotic limb, catacrotic limb, and this catacrotic limb has a notch. Now anacrotic limb. What is meant by anacrotic limb? Anacrotic limb or a primary wave is an ascending limb or a upstroke. It is due to rise in a pressure during the systole when the heart contracts. It is easily said, volume less, pressure increases, so pressure increases. Here we can say it is pressure on y-axis, and this is time, we can assume, on x-axis, right? As the time passes, the changes in the waves is represented in a graphical format, right? Now what is meant by catacrotic limb? When catacrotic limb is a descending limb or downstroke, it is due to fall in the pressure during diastole. Diastole means during the relaxation position, right? Now we see that when heart relaxes, its volume increases, so pressure decreases. So we can see pressure decreases. But have you noticed here something called as a notch? Why that notch, or one more word, incisura, is given? Now this notch happens due to a condition. When we learn about the cardiac cycle in our past classes, we have seen that there is a closure of semilunar valves when the blood is flown from flown from left ventricle to the body parts, right? Now from left ventricle to body parts to the through aorta, right? And that aorta has semilunar valves, right? Semilunar valves. Now that semilunar valves, when that semilunar valves closes, this notch is produced. Now imagine a thing. You have one container and you have putting pressure in that, okay, or you are putting any liquid, and suddenly you close that container. From between, the pressure rises up to a certain extent, so that pressure increase due to the small notch. Its pressure increase is represented by this small notch. It is also called as incisura, right? Now the phase between the phase before the notch is called as pre-catacrotic waves, and after the notch is called as post-catacrotic waves. Usually when we see that pulse is palpated on radial artery, right? Because it is easily approachable, easily any physician can approach it, right? However, arterial pulse can be felt in different areas. It can be felt each and every superficial artery which is easy to feel, which is superficially located on the body, we can feel arterial pulse on that part. We will see it in the next point. Temporal pulse. It is located here. Some thin, lean people's body, we can see that we can see the artery here. right? And that arteries, sometime when they become aggressive, it also, we can see the dancing that artery, right? It is clicking, coming outside, we assume like that. So it is temporal artery. We can also check pulse there. Facial pulse at a facial artery at the angle of jaw, right? Carotid artery, here we can assume. Axillary pulse on axillary artery. Axillary artery is located on the humerus surgical neck. We will learn it afterwards. And branchial pulse at a cubital fossa. It is cubital fossa. Branchial is a muscle which is a part of the biceps muscles. Now radial pulse, common pulse, ulnar pulse on the medial side. Okay. Femoral pulse at a groin. Now groin is a new term. Groin means, when you will check it, Google it, it is means that a part where your trunk and your two limbs meet, that point is called as groin. There also we can check the femoral pulse. Popliteal pulse at a knee, that is fossa, as here is a cubital fossa, at a knee there is a popliteal fossa. Dorsal pedis pulse, it is observed at a dorsum of your foot, right? And tibial pulse over the back of ankle behind the medial malleus of on posterior tibial artery. Now medial malleus, this malleus is a projection of the bone, of the tibia bone, which we will learn later in osteology, right? How to examine the pulse? It's very interesting. You have to take your three fingers, index finger, middle finger and ring finger, right? Index finger is used to occlude the blood flow from radial artery. Occlude means to stop the blood flow. Stop the blood flow from radial artery. Ring is used to occlude the retrograde. Retrograde flow means back flow of the blood from ulnar artery to palmar arc. Now this is hand, right? So in that hand, the one artery comes which forms the arc between the radial and ulnar bones. So this is radial, it is coming from radial, we occlude this, but when it comes and it goes again back, we have to stop this flow also, and that work is done by ring finger, right? And from middle finger it is used to assess the pressure, it is used to feel the pressure, right? It's very easy. Now when we see the pressure or when we see the pulse, what we have to examine? We have to examine its rate, we have to examine its rhythm, character, volume, condition, delay. The delay are of two types, that is femoral delay and radial delay, right? Now rate, when we check the rate, we have to feel it for 30 seconds at least. You can also take it for 1 minute, but 30 seconds is must. Okay, we have to take it for 30 seconds. If there is 36 or 35, we have to multiply it by 2, so we can get our average is 72 per minute, right? Now this is pulse rate at different age. You have to by heart it. If you have nice memory, you can by heart it. But that means what is the nature, I will tell you. Pulse rate at different age. In fetus it is assumed more, and it has more. Assume not, it's not assumed, it is reality. In fetus it is more, pulse rate is more, and at puberty it gradually decreases, right? Now variation in the pulse, when pulse rate increases or when pulse rate decreases. Pulse rate increases during exercise, as we all know. Okay. Pregnancy because children's heart pulse rate also mixes, so pulse rate increases in pregnancy. Emotional conditions, depression, fear, anxieties, right? Fever, why fever? Homeothermy. Our body generates energy, our body metabolizes more, so heat is generated, and when heat is generated, more energy to stabilize that energy, our body works more. So at a time of homeothermy or fever, also pulse rate increases. Anemia increases. Hypersecretion of catecholamines increases. Hyperthyroidism also increases, right? Now pulse rate decreases during sleep, hypothermia. hypothyroidism, and incomplete heart block. Now block is there, so how pulse can move? Now in the case of thyroidism, thyroid is a hormone, right? We have learned in our past classes that thyroid is a important hormone for metabolism. So when metabolism is more, hypothyroidism means more thyroid hormone, our body has to work more. So work more, then more pulse. At hypothyroidism, our body has to work less. So pulse rate also less. Rhythm, the heart rate should be in proper rhythm. It's not like that first is more, and then after some interval, then second, then third, then after some interval, then second, then third. No, it should be proper rhythm, right? Now character denotes the tension on a vessel wall produced by the waves of pulse. Character means how the pulse is. It is more stretching the vessel, or it is less stretching the vessel. That is characteristic of vessel. All these anaglotic pulse, water hammer pulse, pulses paradox, etc. are pathological problems related to pulse that I will discuss in the next video of this series only, arterial pulse. Now volume of the vessel by this transmission of pulse is also determined, right? Now condition of the vessel, how the vessel is also checked, assessed during the arterial pulse. Now delayed pulse, sometimes arrival of pulse in a peripheral arteries is delayed. It is important feature, and it is useful in diagnosis of certain disease. The types of delays are femoral delay and radial delay. There are two types of delays. Remember, it's femoral delay or radial delay. While palpating the radial pulse and femoral pulse simultaneously, there is a short delay because peripheral part, it is peripheral part, but this peripheral part is as compared to this femoral peripheral part is more, right? This is less, this is more. So there is a short delay, but prolonged and noticeable delay in the arrowing of femoral pulse indicates catacrotic narrowing of aorta, which is again a pathological condition which we will together discuss in our next video, right? Now radial delay, when both the radial pulse are examined simultaneously, sometimes the arrival of pulse is delayed on one side, is called radial delay or radial delay, or radial inequality. This indicates the narrowing of a large artery due to atherosclerosis. It is a certain atherosclerosis is a pathological term again, where there is a fat deposition. We have learned in our past classes, right? And in this condition, we have two hands. On two hands there is a two forearms. On two forearms there are two radiuses. On that two radiuses there are two radial arteries. Sometimes in this radial artery the pulse rate is not felt. Here it is irregular. Here it is delayed by 0.01 seconds. Here it is delayed for 0.02 seconds. It is a pathological condition. So we have to take under consideration. So for today I will stop here. We will meet in the next lecture of this series for pathological perspective of this particular topic.